let's continue. And we have Professor and Dr. Shan Liu, who is an associate professor of emergency medicine at Harvard Medical School, USA. Dr. Shan Liu is a great granddaughter of Dr. Wu Lieh-Teh. She is currently an associate professor of emergency medicine, Harvard Medical School. Dr. Shan Liu is the MGH Geriatric Emergency Medicine Division Fellowship Directors and is Academy of Geriatric Emergency Medicine President. She is an attending physician in the Department of Emergency Medicine at Massachusetts General Hospital. So Dr. Shan Liu, please.
Good morning or good afternoon. It's 1 o'clock in the morning here in Boston. So
thank you for joining us at such an inconvenient period of time.
This has been such an honor and just a wonderful event. President Zhang Zhe, President Communicable, Dr. Wang Chen, and Minister Jamaluddin and Ambassador Yujing, and colleagues and other physicians and professors. It's been such a pleasure to be part of this conference and hear about the legacy of my great-grandfather. I will spend the next hopefully 10 minutes or so just speaking about how his legacy has impacted my life. I have a short PowerPoint presentation here. If I can share the screen. Does that work? People can see that?
Yes, we can see that. Thank you.
Okay, thank you. So I'll take this, thank you for giving me this platform to just speak about the personal impact Dr. Wu had on my life. Ever since when I was a child, I saw the autobiography of Dr. Wu on our living room table. And as those of you who have the book know, it's probably about 500 pages. And as I was growing up, it was always a constant in our living room. And I didn't really understand who he was. I just knew that as I grew older, my father would tell me stories of his grandfather, saying that he was the equivalent of the Surgeon General in the United States, but in China, and that he did amazing work in controlling the plague back in 1911. It wasn't really until 1995 when I went to China and was invited along with my father to join the celebration of the 80th anniversary of the Chinese Medical Association, did I really sort of understand the impact of all of the contributions that Dr. Wu made to China, as well as to modern medicine in general. For me growing up, I can't remember a time that I didn't want to do public health, and I can't remember a time that I didn't want to be a doctor. And I think it was because of all of these stories about his heroism, the heroism of Dr. Wu, as people have said before me, his incredible dedication to helping the people and to helping humankind through scientific discovery and through the invention of his mask. So after I entered medical school and residency, I did go to Singapore, where I met Auntie Yulin. And at that time, she shared many more stories about her father and published this book called The Memories of Dr. Wu Lieh-Teh, the Plague Fighter. And it was, during that time when that got published, that it was much more accessible because it was an abridged version of the autobiography and had multiple photos that kind of made the story come alive. And I became much more aware of all of his contributions. And it was in 2018 that the Dr. Wu Lieh-Teh Society organized a trip to Harbin as well as to Beijing to sort of walk in the steps of Dr. Wu and visit the important sites of his home as well as the places where he did research. And so this picture is in 2019 in October, and this was a trip organized by Alice Chong, where my father and my mother came from California, which is on the other side of the United States, and I brought my children and my husband, and we met in Beijing, and this is the house where Dr. Wu lived. And I think now China has made it into a museum. And this has been a very special moment because for years we had gone to Beijing, but it had been inhabited by others after Dr. Wu left during the war to go to Malaysia. And so my father remembers, going to this house, playing in the yard or playing in the courtyard. And I felt like that this photo of 3 generations is very special to us because it may be very difficult for us all to go back to Beijing and be able to visit this place together. So on that same trip, we did go to Harbin, and we walked in the footsteps of Dr. Wu in terms of going to his research institute and visiting the place where he researched about the plague and spent many, many years in his plague laboratory. So this is a picture with my son and my parents at Harbin University. And one of the best things about this visit was really just having my children understand the legacy of Dr. Wu and to be able to visit, as young children and see exactly all of his contributions. And of course, they're probably too young to really remember, but these pictures will remind them of where they came from and to have pride in their lineage and their pride in what Dr. Wu did for others. And so 2018, you fast forward to 2020, and Dr. Wu became, even in the United States, across the world, a much more written about. And Dr. Christos Lien-Teh, who's a medical anthropologist, largely has done a lot of work in sort of publishing in the medical anthropology literature about, who created the first masks to be worn to prevent the spread of respiratory infections. And this is published in the New York Times, which is a very big publication in the United States. And he wrote this very long article about why people wear masks during epidemics and credited Dr. Wu with really starting this movement to stem the spread of diseases by wearing a mask, and thus the Wu mask was credited with being like a prototype of the N95. And then this obviously became very personal. I'm an emergency physician, and so although it was a very scary time at the beginning of COVID, it made me feel very close to the memory of my great-grandfather because it gave me a small inkling of what he must have gone through to leave his family and go up north to Harbin and be in charge of trying to figure out how this disease was spread 100 years ago, and had to create this mask to be able to prevent the spread to others and to protect himself. And a century later, it felt amazing sort of to understand what he must have gone through with a disease that is much more deadly than COVID, and still be incredibly brave and be able to sacrifice his own health and risk his own health, I should say, in order to serve others. And I felt very inspired to do the same, even though it was scary. And even though every day I was very scared to bring home the disease to my family, I felt very inspired by his legacy and his memory and wanted to do his memory, wanted to honor his memory. And it was incredible to every day go in and wear the mask, the N95 mask that my great-grandfather is credited with playing a part in designing to protect myself and to protect my patients as well as my family. So it was during that time where I think there was a lot of frustration in my part in terms of very inconsistent mask mandates in the United States, which continued to be very inconsistent. But I wrote several opinion pieces trying to explain that in Asia and with the legacy of my great-grandfather, that the way to control COVID is to, socially distance, to quarantine, and to wear masks. And so what I was in my effort to try to impact public health, try to teach others my colleagues, as well as other people in America, that we really do need to come together as a country and learn from Dr. Wu and his legacy and what he did 100 years ago and how those lessons can be implemented today. And so part of one of the personal stories of his impact was, as we all know, the kids had to be homeschooled all over the world because largely many of the schools were closed at the beginning of 2020 and beginning of the COVID pandemic. And so I enrolled my daughter online, and she was 6 at the time, and they had to do a nonfiction assignment. And during this time, there were a lot of discussions about masks, and I decided that we would talk about her great-grandfather. And so this is a picture of her, assignment and what she wrote. And unfortunately, she didn't quite get the mask wearing right. Of course, you have to cover the nose. But she impacted, Dr. Wu has also impacted my children a lot. And this is just an example of how he has impacted our whole family, from, my father to me, and as well as my children. And so Dr. Ho, who will give a lecture, I think later on in the conference, played an integral part of getting many of us together as in terms of the descendants of Dr. Wu. And, one of the great things and the silver linings of COVID is that, internationally, we can get together on Zoom like we are today. And so many of us from different parts of the world had a Zoom call and connected with one another. And what came out of this was an article, which Dr. Ho will talk about, that my sister wrote, Ling Lu. And Google ended up seeing that article and then contacting her and wanting to honor Dr. Wu on his birthday last year, so March 10th, for his 142nd birthday. And that Google Doodle was, for those of you who may not have Google, it's a search engine in much of the world. And for 24 hours, they often have these doodles that commemorate either a holiday or a person. And Dr. Wu was commemorated for 24 hours. But this was, in 40 different countries. And so there was a little explanation, a little article that followed about what he did. And my sister and I also published, impact that Dr. Wu had in our life. But that story got shared all over the world. And again, this is our visit to I think Peking University, where I was with my parents. And just to say that his impact and his legacy lives on through all of you who are interested in his legacy, and all of you who are working in various ways to fight COVID. And that this whole conference is just very inspiring. And it's a wonderful testimony to what he did, what Dr. Wu did in 1911, which was to spread information, to inspire us to collaborate, and that nobody, not one country can fight COVID alone. Not one country can fight pandemics alone, and you do have to cooperate. So it is with great gratitude to all of the organizers of the conference, and to all of you who are using your time and your expertise to share your thoughts about my great-grandfather, that I appreciate all of your work and all of your time in having his legacy continue. Thank you very much, and be safe.